Good afternoon and welcome to the St. Clair County COVID-19 Daily Briefing. I'm joined here with Chairman Mark Kern and Samantha Bierman from the Health Department. We'll start with Sam on today's numbers.
Thank you, Brian. So as of today, we have tested 14,486 St. Clair County residents with 1,869 positive test results, which is an increase of 32 from yesterday, and that does include both men and women from their teens up to their 70s. We are at 12,573 negative test results with 44 results that are still pending. Unfortunately, we are adding one new death today, which brings our total to 136. That was a man in his 70s who did have underlying health conditions, and as always, our condolences go out to his family. For those who have completed the required IDPH 14-day quarantine period, we are at 1,369. For state totals, we are at 1,428,841 that have been tested, with 138,540 positive test results, which is an increase of 715 from yesterday. And we are at 6,770 deaths for the state, which is an increase of 64 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, our numbers today are looking very good. We have 29 patients that are admitted due to COVID-related reasons, and only one of those patients is on a ventilator. For congregate living facilities in outbreak status, and that does include staff and residents, 2 or more that are either COVID positive or who have COVID-like symptoms. Atrium of Belleville has 2 cases and no deaths. Brea of Belleville has 51 cases and 6 deaths. Brea of Cahokia has 25 cases and 2 deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 71 cases and 10 deaths. Cedars of Lebanon has 2 cases and no deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. The Esquilin Damert Center at the Shrine has 2 cases and no deaths. Four Fountains in Belleville has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville currently has 8 cases and 1 death. Lebanon Care Center has 55 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. Mercy Rehab and Care Center in Swansea has 2 cases and no deaths. New Athens Home for the Aged has 57 cases and 7 deaths. St. Paul's Home in Belleville has 45 cases and 14 deaths. Swansea Rehab and Care Center has 29 cases and 6 deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. 600 tested since yesterday.
Yes.
And the numbers with only 32 positives out of 600, that percentage is...
It's well under what we need to be. So, it's a good day.
Keep that going. And also today we're going to move into the zip codes. You'll see that one of our zip codes reaches the milestone of 200 today, and that's a number that we don't want to see, but that we felt was coming for some time. So let's hope that it's the last zip code to reach 200. In 62059, we remain at 7. 62201 goes up by 3 today to 78. 62203 goes up by 1 to 61. 62204 goes up by 1 to 63. 62205 goes up by 1 to 69. 62206 goes up by 4 to 158. 62207 goes up by 2 to 106. 62208 goes up by 4 today to 100. 62220 goes up by 1 today to 158. 62221 also goes up by 1 to 157. 62223 goes up by 4 to 69. 62226 goes up by 4 to 200. So 62226 is the one that reached 200 today. 62232 remains the same at 34. 62239 goes up by 1 to 18. 62243 goes up by 1 to 10. 62254 goes up by 9 to 92. 62255 goes up by 1 to 7. 62257 remains the same at 13. 62258 goes up by 1 to 18. 62260 remains the same at 12. 62264 remains the same at 56. 62269 remains the same at 95. And 62285 goes up by 1 today to 20. So as we see how things are going, the one constant that you hear from whether it's television or what you read in the newspapers, the recommendations that are coming out really say wear that mask. The mask is the key to making sure that we continue to control the spread of this virus. So when you wear the mask, you keep others from getting it should you have it, and by wearing so the other person wearing the mask protects them. You're being protected. The whole thing works together. So let's all wear the masks, and together we can solve this issue. And we get good news, which is moving into phase 4. Along with that news that came from the Illinois Department of Public Health and Governor Pritzker is that there is now guidance for the reopening of schools in the fall. And as promised yesterday, that's a long document, but Susan Sarfati, our regional superintendent of schools, was able to stay up all night reading the document, and she's here today to report on exactly what the synopsis is. How are we going to open schools in the fall, Susan?
Well, it is a long document. It's 63 pages, and I did read it rather late last night, but I've kind of summarized it, and there are guidelines, and there are a few absolutes, but most of what we're seeing is that the local school district is going to have to come up with a plan. So in the words of the state superintendent, we have a return to school, but it's not going to be a return to a normal, because school is going to look very different for our students and for our teachers this year. I'll run through the absolutes and then talk about what things our individual school districts need to do. First of all people in a school will be required to wear face coverings at all times. A face covering is either a mask or that face shield that we've seen some people do. Just having a piece of plexiglass in between students is not enough. And just doing the 6-foot social distancing is not enough. Face coverings are required. We've heard that when we go into phase 4, we can have 50 people in one group and in one space. That's not in one school building. It would be in a classroom or in a particular area within a school. So you can have more than 50 people in a school. It's 50 per area. Much of the guidance talks about doing something as much as possible. We all know, if you're a parent, you know that a 4-year-old keeping a socially distant 6 feet from another 4-year-old is not going to be easy, and it's not going to happen every minute of every school day. So it's as much as possible. Another absolute guideline is that there will only be 50 people allowed on a bus at any one time. But knowing, and again, face coverings are going to be required, but you may have to seat 2 students in a group on a seat together, but 50 people will be the limit on a bus. So look for some changes from your typical bus route. The taking of temperatures and the assurance that everyone entering the building is symptom-free will have to happen every day. But our districts will have to do the detailed planning. Will that happen at home? Will it happen before they get on the school bus? Will it happen as they come in the front door? All those things are things that have to be worked out by the district. There is also a very specific cleaning protocol that has to happen every night after the students leave. And if there is a COVID positive in a classroom, there's also very specific guidelines of how to prepare for our students to return to that classroom. And there are specific guidelines about what happens if a person becomes COVID positive within a classroom. The length of time that that classroom has to be shut down before it can be cleaned. What happens if to the student who is sitting next to a person who is COVID positive, all that is laid out in the plan. And finally, it's really important to limit the sharing of objects. I know in a lot of primary classrooms, you might have a pod, in a typical classroom, a pod of 4 desks and a canister in the center of pencils, where you just a student would grab any old pencil and use that. That's not going to be able to happen. So you may have a slightly different list of school supplies for this year based on COVID positive, or COVID this year. Lots of local planning. There are 3 types of plans that districts have to come up with. I think I mentioned that on Sunday. We have to cover in-person learning. We have to cover if remote learning would happen again, where the governor would shut down our schools completely. And also we need to look at hybrid learning. Is there a way we have some students in and some students out? If we have an outbreak where we have quite a few COVID positive students at home and still have in-person learning. So those are the 3 things that schools are going to be working with. And the list of things to come up with is long. It's almost half of my page. Things like playgrounds. How do you deal with playgrounds? Walking in the hallway, traffic flow, lockers, classrooms, teachers moving, students moving, social emotional needs of kids. We're going to have students coming back who have had 3 months of missed instruction plus another 2.5 months of summer. So the summer slide that we talk about in education is now almost a summer, it's not just a summer slide, it's a 6-month slide. So how are we going to assess where each student is, meet the needs of that student, and then move forward academically, socially, and emotionally? And we also need to bring in all the things that we've seen after the result of George Floyd. And that is also something that's really going to impact our return to school. We have special ed issues. We are going to be able to do grading this year, but that's going to require a lot of work and support on our classroom teachers if we have some students that are learning at home. So making sure that all kids have the technology they need, that they have the hotspots or the connectivity, and they know how to use the device. When high school students were asked as we were leaving in March, do you all have a device? Some of them held up their phone and said, yes, I've got a device, but you can't do remote learning with an iPhone. It just isn't working. So to say that our schools are going to be busy and our administrators and our teachers are going to be busy and working with members of the community and with the school board to develop these plans for a short 6 weeks from now, they're going to be very overwhelmed. So my message to parents would be, please be patient. None of us have been down this road before. So it's a first. Also be flexible, because we've seen in the last couple months how things change. The more knowledge we get, the more information we have, the more guidance we have, then we have to go back to the plan and rework it. So please be patient, please be flexible, and please don't hesitate to communicate with your school district. Check their website, check your emails, however your school communicates with you. Many of our schools do phone blasts or email blasts. They're going to want to keep you as a parent as informed as they possibly can.
So the issues that I see a little bit, not knowing as much, it would seem like many of the teachers' lesson plans almost have to be out the window, and they're going to be rewriting just the basic learning schedule for students this summer.
And we're going to have students that that left the same classroom, and they can be at different levels because of the amount of learning that they did during March, April, and May, and just how quickly some students learn over others. So it's going to be a real challenge.
And the PPE that's going to be required, the amount of masks, I would assume if they're disposable, that would be a new mask every day. That number has to be huge, and I would think that there may be a shortage of those if every school goes online needing the same thing. So I would guess you're going to ramp up to that and start making requests for PPE, or
Well, I will for the school that I run, but I do know that the state of Illinois is going to be providing the children in Illinois 2.5 million masks, cloth masks, that can be washed and reused. I'm not quite sure how that distribution is going to take place, but that's a hefty number. But that will be incumbent upon the parents to wash those masks. The only schools just don't have washing machines to do that kind of work. That's going to be a job that parents will need to kind of take on to keep their children safe.
Maybe that's a regional superintendent duty that you may want to decide.
Well, let me think about that. I'll get back with you before Friday.
You find a use for those Tide Pods now. Anything else that we need to add onto things? I mean, it's really all learning. It's everybody banding together, but staying in touch with your local school board is going to be imperative, because there's enough wiggle room in these guidelines that every school probably will have a little different mechanism
Right.
that'll occur.
And the other thing is don't expect to be able to just walk into your school, sign in the office, and walk down the hallway like you may have been able to do in years past. The admission of visitors will be extremely limited due to all the cleaning protocols and all that's required.
Well, Susan, we appreciate you being here, and certainly
thank you.
we're going to need you to come back in the future, because there's plenty of questions. I think the schools really, that's going to be the long pole in the tent for a while.
Well, I was on a webinar this afternoon with the State Board of Education and superintendents, and they did say that this is part 3 of our transition to learning. There is going to be a part 4 that's supposed to come out with more details sometime in July. So
You make your reservation to come back here in July.
you betcha.
Brian?
Well, Susan, as the chairman said, thanks for joining us. On the EMA front today, another busy day. We started this morning with a conference call with our hospitals and EMS providers, finding out what they need, how their responses are going, etc. Health department was able to do a little work, help one of our hospitals out that was having some testing shortages, so we were able to get that taken care of and get them some assistance. The mobile testing that we've been talking about started today. They tested in Fairmont City, they tested in Marissa, they tested in Smithton. I know you've talked with Chief Allen from Fairmont Fire and said the testing was going very well down there, and there was a lot of people taking advantage of it. So if it's in your community, take advantage of that testing. If it's not in your community yet, talk to your leaders, find out when it's going to be there. We're definitely working on that. Tomorrow, the mobile testing will spend the day in Mascoutah and also in Fairmont City. And then next Tuesday, the 30th, heading to O'Fallon for some testing. And there will be more of those dates and more locations announced in the coming days as the locations are worked out and all the different aspects that they have to make. Director Simmons joined us again this morning for some of our conference calls and meetings. He's getting stronger every day, spending more and more hours in here with us, leading the charge here of Team St. Clair and making sure that we have everything we need to do these briefings in the afternoon. And so we're glad to have him back in the office and see that time getting longer each and every day, and hopefully back here with us on the briefing in the near future. So we thank all of you for joining us each day. We know there's a lot of questions out there as it relates to the schools. We had hundreds of comments last night on the page. Susan was able to cover some of those topics. But I think the point that everyone needs to take out of this is it's a very in-depth guidelines that is going to be district by district to figure out how they adapt for their students. So give your school districts some time, give them that energy that they need to focus on this, and put the best plan in place for your students to make sure that they're safe if and when they return in the fall. So we thank you for joining us. Cindy and Daisy will be here in a few minutes to translate this to our Spanish-speaking communities, and we'll be back with you tomorrow at approximately 3:30 with our next daily briefing. Thank you.